Let's talk about post-operative instructions after a urethroplasty. When you're discharged, you'll be given this packet of discharge instructions. Let's go over this briefly. First of all, you'll go home with a catheter in place. This catheter will remain in for 3 weeks until you come back to the office, have a quick dye test, and the catheter is removed. The incisions in your genital areas are closed with stitches that dissolve on their own. You can remove the dressing the day after surgery. Then you can take a shower. Sometimes the incisions will get a little bit crusty and have some mild drainage. This is okay. Keep these areas clean. You can apply over-the-counter antibiotic ointment to prevent sticking to clothing. If you have an incision inside your mouth, it is also closed with stitches that dissolve on their own. You do not need any special care for the mouth wounds. You can eat or drink anything you like. You can use an over-the-counter mouthwash a couple times a day if you need, but it is not completely necessary. We will send you home with pain medicines, bladder spasm medicines, and stool softeners. Typically, no antibiotics are given after surgery. You can take over-the-counter NSAIDs like Advil, Aleve, or naproxen to ease your pain. Avoid taking Tylenol while you're taking the prescription medicines that we give you, as these medicines already contain Tylenol. We ask that you wear tight underwear and or jock straps to keep compression on your scrotum, at least for a week after surgery. If you have significant swelling or bruising, it is acceptable to also use ice packs. You can lie down or walk as much as you want. Avoid sitting upright on firm surfaces, as it may put too much pressure on the repair. We ask that you use a pillow, donut, or recliner if you need to sit up for extended periods of time. Your catheter is your lifeline. Make sure it does not get pulled, tugged, or ripped apart. It is normal to have occasional blood in the urine. It is also normal to have urine drain around the catheter. This is how the catheter was designed to work. You should plan to be out of work for at least a week following surgery. Most patients avoid going to work as long as they have the catheter in, which will be about 3 weeks. Your ability to return to work after surgery depends on the kind of work that you do. Desk or sedentary work can be done with the catheter in, while strenuous physical work cannot be done with a catheter. As far as sexual activity, if you have an incision on any part of your penis, no sexual activity for 6 weeks. If your incision is entirely behind your scrotum, you can have sexual activity after 4 weeks. You should not drive while you're taking pain medications. Most patients avoid driving as long as they have the catheter, which tends to be about 3 weeks. It is possible to drive with the catheter as long as you secure the catheter to your left leg so it does not pull when you're pushing on the gas or the brakes. If you have any further questions about your post-operative recovery, please contact the office.